Hello everyone, my name is Rishabh Agarwal and here I prepared a PPT on chicken infectious anemia. Here's the outline of the following PPT. It is a disease of young chicks caused by a circoviridae virus. The disease is characterized by aplastic anemia and generalized lymphoid atrophy. It is also accompanied by immunosuppression. This disease was first reported in Japan, initially caused by chicken anemia agent, but it was classified under circoviridae and now is called chicken infectious anemia virus. Characteristics are chicken infectious anemia virus is remarkably resistant virus. It can resist heating at 80 degrees Celsius for 15 minutes and exposure to pH equal to 3. Serological surveys indicate that chicken infectious anemia virus infection is common throughout the world. It is not known any domestic fowl is infected or not. All isolates of chicken infection virus isolated to date belong to a single serotype. Here's how it is spread. It can be spread through vertical transmission. Here's it is how by horizontal transmission. Infection occur through respiratory route may be also be possible. Its pathogenesis is anemia and other pathological changes occur in neonatal fully susceptible chicks. Chicken infected by contact shed virus, maternal antibodies protective. Chicks with maternal antibodies usually show no disease or anemia, but they may shed the virus. Dual infection, chicken infection, anemia virus, and immunosuppressive viruses enhance the pathogenicity of the virus. Immunosuppressive viruses such as Marek disease, IBD, and reticuloendothelial virus, it results in greater mortality and more persistent anemia and microscopic lesion. The protective effect of maternal antibody may be overcome. The age resistance is overcome, and contact infected chicks also develop anemia. Chicken infectious anemia virus has recently been shown to be immunosuppressive. Functional changes and replication. Functional changes were detected in splenic lymphocytes and splenic and bone marrow macrophages. The main sites of virus application are precursor T cells in thymic cortex and hematocytoblasts in bone marrow. The virus also replicates in all lymphoid aggregates throughout the body. Destruction of these cells accounts for immunosuppression and anemia. Signs are 2 weeks of age. The young chicks show variable mortality. Mortality may go even up to 60%, but usually average around 10%. Most characteristic changes are anemia, aplasia, atrophy of the thymus. Affected birds are depressed. Hemorrhages may occur under the skin, enlarged liver, and gangrenous dermatitis. Gross lesion. Thymic atrophy is the most consistent lesion. Thymic atrophy may result in complete regression of the organ. Bone marrow atrophy is the most characteristic lesion. Femoral bone marrow is fatty and yellowish pink. As infected virus chick develops, thymic atrophy is much more consistent lesion than grossly visible bone marrow lesions. Bursal atrophy is less noticeable. Hemorrhages in the proventricular fossa and subcutaneous and muscular hemorrhages are sometimes associated with severe anemia. Microscopic lesions. In the anemic chicks, microscopic lesions have been characterized by panmyelophlebitis and generalized lymphoid atrophy. In the bone marrow, atrophy and aplasia involve. Hematopoietic cells are replaced by adipose tissue or proliferating stroma cells. Severe lymphoid depletion is seen in the thymus, bursa, fabric acid, spleen, and cecal tonsils, as well as in a wide range of the other tissues. The thymus, cortex, and medulla become equally atrophic. Lesions in the bursa fabrica consist of atrophy of the lymphoid follicles. In the spleen also there is atrophy of lymphoid tissue. In the liver, lungs, kidneys, proventricular duodenum and cecal tonsil lymphoid foci are depleted of cells. Hematology. Blood of severely affected chick is more or less watery, clotting time is increased, blood plasma is paler than normal, low hematocrit values, hemorrhagic aplastic anemia syndrome. Outbreak of the infectious and field flocks are mostly associated with hemorrhagic syndrome, with or without gangrenous dermatitis. Here's how it is diagnosed. In situ hybridization helps. Dot plot hybridization, polymerase chain reaction. Serum antibody of the virus can be detected by a variety of serological tests such as serum neutralization, indirect immunofluorescence, ELISA. Thank you.